or say welcome to Zoom. Good afternoon, and welcome to the Kern County Hispanic Chamber of Commerce Program, COVID-19, Employment Law Compliance, and HR Counseling Issues. Today's program is being presented by Jay Rosenleib, Chair of the Labor and Employment Practice Group at Klein, DeNatale, Goldner, and Donna Thrasher, Senior Human Resources Consultant at Klein, DeNatale, Goldner. This program is based on information current as of March 17, 2020. Given the developing nature of the response to COVID-19, employers and business owners must consult the most recent information from government sources and their legal counsel. Links to the website of relevant regulatory agencies are included in this program. Attendees to today's program may submit questions by using the Q&A button located at the bottom of their screen. We will now begin today's program.
Good afternoon and welcome to our program. My name is Jay Rosenleib, Chair of the Labor and Employment Group at Klein, DeNatale, Goldner. I'm joined by my colleague, Donna Thrasher, Senior Human Resources Consultant, also at Klein, DeNatale, Goldner.
Good afternoon.
We'd like to start with some background on COVID-19, otherwise known as the coronavirus. Many of you already know this, but we'll just go through the basics and go from there. Coronavirus is not a flu. It is a pneumonia-like infection, first identified in Wuhan, China in 2019. First cases were identified in the United States in February of this year. Current countries at level 3 advisory known as avoid non-essential travel: China, Iran, South Korea, the Schengen countries of Europe, which are basically all of Europe, United Kingdom, and Ireland. There is a global level 2 advisory directing all travelers to practice enhanced precautions. There are currently over 4,600 cases identified in the United States, compared to just over 3,700 yesterday. Those cases are in 49 states and the District of Columbia. The only state that has not yet had a reported case is West Virginia. California yesterday had approximately 470 confirmed cases, compared to today with 580 confirmed cases. California schools, including Kern County public and private schools, are closed, and businesses are otherwise taking action, including closures and online and telecommuting. COVID-19 is transmitted person to person in close contact through respiratory droplets. That's why you hear the social distancing of 6 feet. We're starting to see signs posted on workplaces and desks in our office here, just reminding people to remain 6 feet away. It is transmitted by means of droplets, as we indicated. Those can be on keyboards, mouses, desks, and other usual office surfaces.
With all that background, keeping our workplace as safe as possible is very important. So we need to make sure that our supervisors and managers do not overreact, but err on the side of caution. And we don't want to create panic, but we need to make sure that we're doing things such as we mentioned here. We've got some signs to remind you to keep your social distance, to make sure that we are keeping the workplace as clean as possible, and not keeping too many individuals working very closely together. So as we do that, we want to make sure also that we don't discriminate against protected categories. So for example, if you were to say that we want everyone of a certain ethnicity to leave, or a certain age group to leave, or a certain protected category otherwise to leave the workplace differently than others, that might discriminate on that protected category. So be cautious, but don't discriminate. You certainly can ask employees to seek medical attention and get tested for the COVID-19 virus, particularly if you see that there are symptoms. And under regular circumstances and current circumstances, if someone shows up to work and they don't appear well, or during the day they start to not appear well, you can absolutely have them leave the workplace if they are symptomatic. Also, if there is an identified infection of COVID-19 in your workplace, identify all employees that have worked within 6 feet of that person in the previous 14 days. And you might go a little bit broader than that, but absolutely that 6-foot social distancing is helpful. But if they're working very closely together, you would determine whether those individuals maybe should also be sent home. Make sure in this process of saying, okay, so someone tested positive, we should send some other people home, that you do not divulge the name of the individual employee that tested positive. That is confidential medical information and is protected. So you need to excuse that person from the workplace and those that worked very closely with them without divulging the name. Have a deep cleaning of the area performed when those individuals leave. As mentioned, those droplets of the virus could be on surfaces in the work area. You'd want to get those cleaned out of there. And then we understand if it's a small workplace, employees may kind of figure out who maybe tested positive first. That is, gossip that they may have. You cannot divulge the name as the employer due to confidentiality.
So some additional general workplace safety guidelines. You should not you can generally prohibit, you cannot prohibit otherwise legal activity such as travel, but you certainly have the right to inform employees that if they return from travel, they may be directed into quarantine, and they otherwise will have to follow Department of Homeland Security directives with regard to quarantine. We do know that travelers returning from China, Iran, South Korea, all of Europe, the UK, and Ireland are being subjected to increased medical screenings upon entry back into the country, and are being directed to self-quarantine for 14 days upon arrival at their ultimate destination within the United States. Their names are also being given by the Department of Homeland Security to the local public health authorities for follow-up purposes. We are also suggesting, of course, that where remote work is practical, that companies engage in and allow remote work. It's not required. You'll certainly want to develop policies and support systems based on input from your IT vendor or internal IT sources. Donna, why don't you tell us about OSHA issues?
Certainly. As we continue on workplace safety, OSHA has some guidelines for us as well. So there may be some employees that refuse to work. They are too concerned about coming into the workplace and want to refuse to work. And they are only able to do that under OSHA guidelines if there is imminent danger. So that's any condition or practice which reasonably could cause death or serious physical harm in the near term. And it also can include a reasonable expectation that a toxic substance or other health hazard is present, and exposure to that hazard would shorten life or cause substantial reduction in physical or mental efficiency. So there's some real limitations there around refusal to work because you think the workplace is unsafe. The employer is required to provide a workplace that is free from hazards and imminent danger, and that might include things such as making sure that surfaces are well cleaned. Maybe your cleaning services have to step up a bit, and making sure that you have that distance between employees to keep them healthy. You really have to determine if the COVID-19 infection is a hazard in your workplace and implement those measures if it is a hazard. In today's environment, it's probably a hazard in most of our workplaces, so you want to make sure that you have preventative measures to reduce any potential of infection and keep your workers as safe as possible.
So, Donna, what specific steps should employers take to minimize the transmission risk?
Certainly that social distancing that we've been talking about, the 6 feet between workers, is important. And then also extra cleaning. And as you minimize those risks, hand washing is just huge. That's probably the number one thing that's been recommended for employees is wash your hands. Use hand sanitizer in the absence of a sink to make sure that you keep your hands very clean. If your hands are not freshly washed, avoid touching your eyes, nose, mouth, facial areas, anywhere that virus could potentially get into your body. Always avoid close contact with people that appear to be ill, whether it's the COVID-19 virus or some other illness. You probably would kind of stay away from people that appear to be sick. And if you are the one that's not feeling well, please stay home and keep whatever ailment you may have away from others, particularly if it's COVID-19 related. As usual, be polite on your coughs and sneezes and cover those. Typically using your elbow to cough or sneeze into is the most polite way to do that. And then clean and disinfect frequently touched objects and surfaces in your home, in your office, to make sure that you keep the virus off of those surfaces. And as we're doing today, teleconference in lieu of meeting when possible to keep that distance. Also, there can be personal protective equipment. I've seen people in retail locations wearing gloves over their hands. Certainly, if there is some protective equipment that makes sense in your workplace, provide that to employees. There is not a lot of evidence that indicates a healthy employee benefits from a face mask.
So let's move on to the wage and hour issues. Of course, there are, with respect to non-exempt employees, basic law is that the employer is not required to keep paying employees who are not working. So in the COVID-19 context, if you shorten a shift, if you lay off an employee, if you terminate an employee, there is nothing in the law that requires that you continue to pay them. Of course, employees who are sick may use their sick leave or their PTO. And of course, this covers preventative care, including and self-quarantine. It is important to note that an employer cannot require an employee to use these leaves. These leaves can only be used at the option of the employee. Now, with respect to exempt employees, if an exempt employee performs at least some work or any work in the employer's designated work week, that exempt employee must be paid their entire salary for that particular work week. If they are out for any particular reason, quarantine, or they're sick or preventive care, they may use the sick leave or the PTO. All right, let's move on to our next slide on wage and hour, and Donna, if you could cover that for us, please.
As you're well aware at this point, schools and daycares are closing. That creates some additional issues for employees trying to work, and they should discuss those options with their employer. There may be some paid leave opportunities. Certainly, Labor Code Section 230.8 has been in place for employees at work sites with 25 or more employees. They can be provided up to 40 hours of unpaid leave per year for specific school activities and emergencies associated with the closure of those school or daycare by authorities. So in our current situation, if you have 25 or more employees, they may be entitled to 40 hours of leave. This leave is unpaid unless an employer already has put paid options in there. An employee could certainly use their vacation or paid time off during this time as well.
Now, it's important to note that if you have 25 or more employees, this only applies to work sites where you have 25 or more employees. So if you're divided up into several work sites, each one of which has less than 25 employees, this leave is not required.
And then there are the employees that are sent home. So maybe you start your workday and say, gosh, we're just going to have to shut down there, this is not going to work, it's not economical for us to operate. So if you send employees home or there's not enough work for all the employees, particularly we're hearing that in the travel industries, there just isn't work, you send them home after they report to work, reporting time pay must be paid. So it's half the shift, no less than 2 hours, no more than 4 hours if they report to work. If they work more than that, more than 4 hours, say they work 6 hours, then pay them for the 6 hours, and then maybe they go home a couple hours early. And again, the exempt employees are paid for the whole work week if they work any part of the work week. So keep that in mind, your defined work week.
Moving on to our next slide, wage and hour alternative strategies.
Yes, certainly as we're trying to be creative in how we do work, there are some jobs that fortunately can be done remotely or telecommute. So for those jobs where it makes sense and you can do that, keep in mind the things that you need to think about as you implement those. We talked about making sure you had policies and procedures in place, but also think about your data security and the safety of your workers. So if they're working from home, you might give them some guidelines to make sure that they are working safely and that they've got their work area clear of hazards so that you don't end up with any unnecessary workers' compensation claims. Also think about pay issues, particularly for those non-exempt or hourly employees that get overtime. They need to have their rest breaks and meal periods, and also if they work any excess hours, be paid for those. So determine how you might keep track of time if that is the situation where you have non-exempt employees working remotely. You don't have your time clock maybe that's sitting in the office building, so you'll have to figure out how they report that to you differently. There are also reimbursement issues. There may be some additional expenses that employees incur to get set up to work from home. Maybe they didn't have the highest speed internet, they need to upgrade that. Determine if there are some things that you might reimburse as business expenses given that they're having to work from home. And then we also need to think about, I guess there's some internet scams being reported at this point in time that are kind of targeted to these workers telecommuting.
So our next slide, we've talked a lot about what the basic wage and hour law is, but one of the first questions from employees that we're counseling our employer clients on is, what about the replacement of my wages? If I'm not going to be able to work because I'm sick, because I've been quarantined, because my child is home from school, how am I going to replace the wage so that I can pay my mortgage, pay my utility bills, etc.? Well, the answer to that is unemployment insurance benefits, or UIB, state disability insurance, or SDI, and paid family leave, or PFL. Generally speaking, employees who have been exposed to COVID-19 are eligible to file a state disability claim, and employees caring for family members who are ill or quarantined with coronavirus are eligible to file a claim for paid family leave. And if both of those, if the employee is not eligible for either of those, SDI or PFL, they can always file for unemployment insurance benefits if they are fully or partially unemployed. Keep in mind that the governor's executive order waived the long-existing one-week waiting period for state disability insurance and unemployment insurance benefits. There always has been a one-week waiting period for both of those. There is now no waiting period to receive SDI or UIB. Paid family leave does not have a waiting period for benefits and has not had a waiting period for the last couple of years. Now let's go into some of the specifics of this.
And certainly, as we say, there's no waiting period. The benefits will not be paid immediately, and as these systems become overwhelmed, it may be, 2 or 3 weeks or more before employees actually receive money. So understand that there's going to be a cash flow issue for these individuals. So as we talk about unemployment insurance, if you're unemployed or you are underemployed, such as you have less hours than you normally would have, you can get unemployment insurance benefits from the Employment Development Department. So understand, if you are unemployed because you have been exposed and you're quarantined, you were separated, or you're laid off temporarily, those things can be unemployment insurance. And if the school is shut down and the employer temporarily allows you to work less time because your child needs care, so for example, you usually work 40 hours a week and they say, well, you can work 20 so that you can, figure out your child care situation, then you are underemployed and could be eligible for unemployment for that partial schedule reduction. The benefits are usually 60 to 70% of pay. Of course, if you're highly compensated, it's much less because it's a maximum of $450 a week. And if it is a temporary layoff, such as you've closed your business for a month due to the coronavirus and you plan to reopen and bring these workers back, these workers might not be required to look for new work in that interim layoff period to collect unemployment benefits. The default with unemployment is you have to be available and looking for work to continue to get unemployment benefits. It is important to note for state disability insurance and unemployment, you can't collect both of them for the same time period. You are either disabled or unemployed on a given day or given week.
So continuing on with wage replacement, Donna, tell us about the specifics of the unemployment insurance work sharing program.
Okay, as I mentioned, if you are underemployed, so you're working less hours than you normally would, it could be considered a work sharing program. So rather than lay off half of your employees, you want to retain the talent as an employer, so you have everybody work half-time rather than laying off half of the people. And so those people are sharing the available work. There's not full-time work for everybody, but these employees are sharing what's left, and so everybody's now working half-time. So they're sharing the work. And what happens there is those individuals can collect unemployment for the reduction in hours from their usual schedule. So it's a partial unemployment replacement for the partial schedule reduction because they're sharing the work and you're retaining the talent of these individuals. And as we continue on there's also state disability insurance. So that's the third component here that we talked about. So there was unemployment, state disability, and paid family leave. So state disability insurance, it's if you're unable to work because you are sick. So you've been exposed to the COVID-19 virus, and either you are ill from it or you are quarantined at the direction of a doctor or a state or local health officer. So you've got to have that medical documentation to get state disability. If for some reason you apply for state disability and you are out of work due to this coronavirus, then the recommendation is, if they deny state disability, apply for unemployment insurance benefits.
And finally, the third leg of wage replacement is paid family leave. paid family leave is, again, a employee-funded program through payroll deduction paid to the state. And instead of being for the employee's own illness, or in the case of COVID-19, quarantine, this is for the illness or quarantine of a family member, parent, child, spouse. It provides 6 weeks of benefits that will extend to 8 weeks beginning July 1st of this year. Like SDI, PFL must be supported by medical documentation of a healthcare provider or a state or local health officer, which names the quarantine or ill family member. It can't simply be a regulation or a press release or some kind of guidance. As indicated earlier, there is no waiting period for the receipt of paid family leave. That begins on day 1. So, the state help for employers, we've talked a lot about wage replacement for employees. What are the benefits and what's available to employers? We have a lot of our clients who are concerned about being able to continue their businesses. There is, through the Employment Development Department, a rapid response team that provides rapid response services. This supports California businesses by providing early intervention assistance to help avert potential layoffs, provides displaced workers with training resources and job search assistance, and EDD benefit claim filing. We do anticipate that the rapid response services provided by the EDD are going to be quickly overwhelmed, so if those are services that you want to access, we suggest that you do so immediately. We also note that the governor has provided that if your business is directly affected by COVID-19, you can request up to a 60-day extension to file your state payroll tax report and deposit state payroll taxes without interest or penalty. This is not a holiday. It is something that you actually have to apply for, and we suggest that you consult with your payroll service or your CPA for further details on that. Donna, tell us about the Fair Employment and Housing Act and the ADA, the Americans with Disabilities Act, and how they impact COVID-19 response.
Particularly, the Americans with Disabilities Act has an implication with COVID-19. It restricts medical examinations in the workplace. And medical examinations are something as simple as taking a temperature. So it is not consistent with the Americans with Disabilities Act to conduct any medical exam in the course of employment, including taking temperatures. I believe there are some industries, maybe in healthcare, that have an exemption around this, but forcibly taking an employee's temperature, like as they walk in the door, you know, instead of just the screening for any metal on the person you're screening their temperature to, that's not acceptable. You can make temperature devices available at employees' discretion to use for themselves, so the strips maybe that you put on your forehead or those kinds of things. If employees want to take their own temperature and record their own data, they can absolutely do that. The Americans with Disabilities Act also prohibits employers from making disability-related inquiries unless it's a job-related or direct threat that can't be reduced by reasonable accommodation. So again, you can't ask them, so, you know, do you have this medical condition? Do you have this disability? What is your diagnosis? Those kinds of questions are not permissible unless it's job-related or a direct threat that you can't reduce by reasonable accommodation. So if an employer regards COVID-19 as a disability, understand that that could trigger the Americans with Disabilities Act. typically, something like the COVID-19 virus or a cold or flu is a transitory condition that is not subject to the Americans with Disabilities Act unless you perceive that that's actually a disability. Transitory means it happens and resolves itself quick enough that it's not subject to the Americans with Disabilities Act. You can absolutely send an employee home who exhibits symptoms without violating the Americans with Disabilities Act. And as we continue in that and talk about not discriminating in terms of equal opportunity, we need to make sure that we don't have a disparate impact on protected classifications. So if we're deciding who stays at work and who is going to be laid off, you need to think about the impact on protected categories in your selection. If it is purely on a job function, like this job function is going to stay at work, the manufacturing people are going to stay at work, and the office people are going to work remotely, that's job-based. But if it's on a protected category such as, age, ethnicity, marital status, anything else that's protected, you would absolutely need to be careful in making those decisions on who is laid off and who continues to work.
So let's talk about the impact of labor relations, collective bargaining agreements, and how that intersects with COVID-19. If you are a workplace that has a collective bargaining agreement in force, keep in mind that there have been no exemptions granted with respect to COVID-19, and that the employer has to maintain its bargain to bargain in good faith over mandatory subjects such as wages, hours, and terms and conditions of employment, which includes terminations and furloughs and layoffs. The sole exceptions to this are if there is a management rights clause that's fairly broad or a force majeure clause in your agreement. The analysis of those is going to be on a contract by contract basis. There does exist in NLRB precedent a doctrine known as compelling economic exigencies that does allow an employer to take action unilaterally. That requires the existence of extraordinary unforeseen events having a major economic effect that requires the employer to take immediate action and make a universal change. I would have said 2 weeks ago that doesn't exist. I would say that that may now exist, but what we do suggest is that if you do have a collective bargaining agreement, that you contact the union representative and let them know what you're going to be doing. Most union representatives that we have dealt with in this COVID-19 atmosphere are indicating flexibility. Donna, what about workers' compensation?
Certainly there are going to be cases where an employee believes that they contracted the COVID-19 virus in the workplace. And that may actually be the case in some situations where they haven't been around anybody else with the COVID-19 virus except their coworker that they worked with on this team project, and they were in very close proximity. So if the virus or whatever illness or injury arose out of and was in the course of the job, it could be a workers' compensation claim. So it may be difficult to say, particularly with this virus, did it arise out of the course of the job, or did you contract it in another location? It's always hard when it's something like that that's out in the community as well. But if an employee believes that they caught this virus at work, certainly as the employer, we advise that you provide them the workers' compensation claim form, the DWC-1 form, and allow them to file that workers' compensation claim, and then work with your workers' compensation insurance provider to sort out whether this is a valid claim or not after that claim has been filed.
So as we know, the governor has been active in terms of issuing press releases, issuing general orders. And what we do know at this point is the governor has suggested that there be large gatherings, or that there not be large gatherings of, I believe it's now 50 or more. Is that right?
Yes.
Okay, so it's reduced from 250 to 50.
With the recommendation that it's not 10 or more.
And also recommending social distancing of 6 feet. The executive order also reduces, as we indicated earlier, the waiting period for unemployment and state disability insurance for people who lose work or who are out of work temporarily due to COVID-19, reduces that waiting period from 7 days to 0 days. The executive orders also readies the state to commandeer hotels and medical facilities to isolate and treat COVID-19 patients. And for any of you who are governmental entities or work with state or local legislative bodies, they may now hold meetings via conference call while still meeting the state transparency requirements under the Brown Act. The executive order also allows state and local emergency administrators to act with even greater speed to protect public health. So that's what's happening in California. With respect to at the federal level, there is something that is being considered currently in the Senate, referred to as H.R. 6201. It is the Families First Coronavirus Response Act. It has not yet passed the Senate. It has not yet been signed into law by the President, and I will say that several times over the next couple of minutes here. It was passed by the House of Representatives very early Saturday morning of this past week on an overwhelming bipartisan vote of 363 yes, 40 no, and a one person voting present. If passed, H.R. 6201 may include federal paid leave benefits program for employees taking leave due to the coronavirus. It will expand unemployment benefits. It will create a federal mandate for employers to provide paid sick leave to employees, and will provide tax credits to small employers, those of less than 500 employees, for mandated paid sick leave. If passed, the H.R. 6201 would include a section referred to as the Emergency Paid Leave Act of 2020. If this is passed, it would allow employees to take emergency leave days due to a current diagnosis of COVID-19, or the requesting employee is under self-imposed or ordered quarantine, or the requesting employee is a caregiver for a person who has a current diagnosis or is under quarantine for COVID-19, or the requesting employee is a caregiver for a child or other person unable to provide self-care because of COVID-19 related to a school closure. Continuing on, if passed as is, this Emergency Paid Leave Act would not apply to an employee who is receiving paid sick leave or vacation time from their employer. and would not apply to any employee who is receiving unemployment benefits during the same week. This would be modification to the Family Medical Leave Act, and for the public health emergency leave, the Family Medical Leave Act would be amended to apply to employers with from 50 or more employees to 1 or more employees, would lower the length of employment for employees from 1 year to 30 days, and would provide up to 90 days of leave, the first 2 weeks of which would be unpaid, and the balance of those 90 days would be paid at 2/3 of the regular pay. Finally, there is the paid sick days for public health emergencies and Personal and Family Care Act. If passed, and again, this is part of HR 6201, covered employers would be those with 1 or more employees. It would provide for 14 days of paid sick leave, and would provide a tax credit for small employers, again, 500 or fewer employees, to pay for the paid sick leave. Here are some helpful links for employers to use. We found these to be very helpful. This concludes today's program.
The Kern County Hispanic Chamber of Commerce thanks our presenters Jay Rosenlieb and Donna Thrasher of Klein, DeNatale, Goldner. We thank you for your attendance today. This concludes today's program.